Dr. Richard Buckley and team at MilfordMD. Remember, this morning's project was to do a face neck lift and some tightening of the neck. And so that tightening part is known as a Central Corset Platysmaplasty. Also, if you'll see the previous episode, I did say maybe we would do a sling, and I did do a neck sling. So there's actually some Gore-Tex that goes from side to side and then anchors behind the ears, and the reason for that is to get even more crispness of this angle. In the beginning today, the neck had some central thickness to it, as develops with so many of us over time. And right now, you can see there is no central thickness to this neck, and this angle here is amazing. And the jawline is crisper because we did lipo sculpting, that is suction of the neck. So often when we do lipo sculpting, it's a closed procedure. In other words, we make a couple of poke holes and run around and suck fat out. Maybe also tighten the skin with laser or Vaser, smart lipo, pro lipo, something like that. We have 7 lipo lasers. In this case, it's even more interesting because since I made a little incision under the chin in order to do that corset tightening of the middle portion of the neck, which we call the central portion. In order to get under there, obviously I can see, and since I can see, I can directly remove fat under visualization. And plus, the little thin curtain-like muscle that bags out with time in the neck, the platysma, also has a little fat underneath it, typically in the center region, as with our patient today. And if I am underneath the skin, then I can also get underneath the platysma and get even more fat out from the center part here than you can if you do it in a non-open technique. Mm-hmm. And you can turn your head over this way for me. You'll notice our patient's awake, and she's agreed she'd like to say something to you in a minute. But I'm not done talking. First me. And so you can see there are some tiny little stitches in here. In general, I don't really like to remove hair, and it's always in my way when I do procedures, but she has long hair, and that hair is just going to cover this whole thing instantly. And plus, there's hair in front of and below this incision that I did trim a little bit so I could at least work some. And plus, my incisions in this area here, the sideburn tuft area, my incisions are beveled. It's something called the trichophytic incision, which means that after it heals up and the little hair follicles continue to grow, they will grow right on through the tiny little scar that we have here. So not only is the scar going to be amazing, I've also made the incision scalloped, which makes it even more amazing. Plus, the hair is going to grow right through it. So we just don't have any bother so far ever with our scars, whether they're from these kinds of procedures, whether they're up here with a brow lift or they're here in this temporal tuft area. They heal up beautifully. Also, with girls, we put the little incision behind this part that pokes out called the tragus. That makes it hide very nicely, and then the scars, meaning now the incisions, are crafted so they're right in the creases that are there anyway. And how far behind the ear I go with my incisions totally depends upon how much loose skin there is on the neck. If there's a lot, then in girls anyway, it's nice to take the incision back on the so-called occipital hairline. Most of the time we can stop it just behind the ear somewhere. In our patient, I went up maybe about that far. So this morning when you first came, you felt a little anxious.
Yes, I definitely was.
And you run a little anxious anyway.
Right.
Right?
Yes.
And so, but how was the procedure for you?
The procedure was amazing. The doctor and the staff here really, they just spoke to me in a regular way, and I knew that they were doing it to calm me down, and it worked. And within minutes, I felt so much better. I was really concerned because I was scared to have it done. I really wanted it done for 2 years, and I knew that I had found the most artistic and genius man that I could find, and so I had every faith in him. When I was on the table, I felt no pain, nothing at all. I was awake the whole time. I think I dozed off for about 10 minutes, and the procedure went perfectly. I'm really, really looking forward to seeing the results. Thank you, doctor.
You're most welcome. Thank you for the kind words. You know, there's a mix of music usually, and it's fun to hum, to sing. Our patients sometimes hum. A little hard for them to sing.
It was fun.
It was fun, right. But one of the comments today from our patient was, okay, so why doesn't the staff sing more and join along? I think that on some upcoming episode we'll do some interesting procedure with a lot of moving parts, you know? And instead of me talking and trying to explain and educate in that sense, maybe the team will just do some fancy vocals, right? What do you think, team? Yeah? Okay, team's agreeing. And yeah, and so that'll be different, right?
Mm-hmm.
So fancy stuff, go with singing.
Thank you for everything.
You're most welcome. So, totally wide awake, as with all of our procedures, our breast augmentation, tummy tucks, lipo, head to toe, you know, surgical arm lifts, thigh lifts, all of that stuff. You know, eyelid surgery, of course, you know, brow lift, all of that, everything. So our patients always wide awake and comfortable. You were, what, 100%, 90%, 80%?
100%.
100%. Kind of hard to beat 100% comfortable.
Yep.
And
When
not
I asked to bend my knees, you said, sure, absolutely, bend your knees.
Right.
Yep.
And I love having patients awake during procedures because we can communicate. I think that's very important. It's helpful.
Yes.
Yeah. All right. Thank you for watching MilfordMD. And thank you for your comments.